Once a healthcare system is resilient, robust, sensitive, and very, very determined, then no health disease or emerging disease can overwhelm it. And so I want to, on behalf of the governor, commend the Commissioner for Health and his staff and all the partners who have worked with us to have dealt with all the emerging diseases that try to rear their head and re-emerging ones that try to rear their head during the last season of the health episode, including the cholera or assumed gastroenteritis, the monkeypox, and the other diseases that came our way, including the very yellow fever incidents. None of them was able to take any life, and none of them was able to overwhelm our health system. This shows that our health system is robust, strong, viral, resilient, and determined to combat any disease that come our way, unfortunately. And so I want to announce to the diseases, both the emerging and re-emerging ones, that Bayelsa is a no-go area for any disease, because we are strong enough, we are viral enough, and we are committed enough to resist them. So diseases can go to other states. I want to also correct this impression that is being populated and undulated by anti-vaccine campaignists. I want to put on record that diseases have been eradicated in this country and in this world through vaccines. Those who do not know, and they need to be reminded, we had incidents of smallpox that was killing people indiscriminately in this country. Through immunization and vaccination, smallpox was eradicated. We had incidents of yellow fever that was killing people indiscriminately and claiming lives. Through immunization, yellow fever was eradicated. Even tuberculosis, people were dying very frequently of tuberculosis. And all those of us who got ourselves immunized with the vaccine, today we are resistant to tuberculosis. And so there's no time anybody will tell you that it is biblical or that it is religious for you to refuse vaccine. That is a lie from the pit of hell. If that were to be true, the message they are passing on, that is meant to do family planning, that is wrong, because they will not need to develop family planning pills, because we have the contraceptives that are meant for family planning. So how can somebody have a drug for family planning and still don't want to use vaccine? Every child should be brought, and we have also met with the school proprietors, giving them a marching order. Any school that does not open for our immunizers or caregivers to go there to immunize, that school will be closed down on the orders of the governor.
Mine is very, very simple. I have come to this point to appreciate a man, a phenomenal human being that has shown leadership in the health sector. Your Excellency, sir, we in the Ministry of Health and the people of Bayelsa are so grateful for this leadership that you have given to us. You have shown leading from the front. Not only that, with your leadership, there is a clear demonstration. With your leadership, UNICEF gave us ambulances to strengthen immunization. With your leadership, we were able to come third in the last year challenge. With your leadership, our public health system is strengthened so that the last episode of outbreaks we had, we did not lose anybody in any of our health facilities. Your Excellency, sir, I will go on and on for what you have done in the health sector, the leadership that you have given, and we do not take it for granted.
Bring your child for vaccination. This is no joke. We want to prevent children from having disabilities that come from poliomyelitis. We're already halfway gone, more than halfway gone, in protecting and taking out polio from the system, but then this is the extra means to do this. Let us seize this opportunity as the last opportunity to do it, because we don't know where funding will come from in the future.
We on our part are supporting you in every respect. And I see this opportunity to call on those Christian leaders who prevent their church members from bringing their children to be immunized. There is no scriptural passage and there is no church doctrine that says immunization is forbidden by God. Those are individual and personal doctrines. An individual should not impose his wrong thought and thinking to members of the church and prevent them from having life-saving opportunities. As a leader of the church in Bayelsa State, I call on all parents to bring out their children for immunization. If any pastor, if any church leader is saying that immunization is wrong, tell that pastor that he is wrong.
We are here because we understand that prevention is better than cure. And once we prevent it, it means we won't have the problem. And this is not a problem that you want to see whether it will happen or not. Because once you are a victim, you're already paralyzed. And so we are here in full force, and I believe this campaign will be a success across the state. No one should, in this day and age, watch his or her baby get infected by polio virus and then become a victim of the society.
Notably, Bayelsa State has not reported any cases of CVPV2 since September 2021, an encouraging milestone. However, to ensure this hard-won progress is sustained, it is essential to maintain high-quality campaigns, increase immunization coverage, and enhance surveillance efforts. These actions are critical to keeping the transmission of variant poliovirus permanently interrupted in the state. As we reach the half point of the Global Immunization Agenda 2030, this year's theme, Immunization for All is Humanly Possible, urges us to close immunity gaps and ensure that no child is left behind.
Congratulations to Bayelsa State for joining hands with the National Primary Health Care Development Agency to ensure that today is marked in Bayelsa State. Today is a great day for every child in Bayelsa State.
Our children deserve our love and protection, so no more zero dose. Clear out zero dose and stand for immunization. We can do better. Immunization.